Okay.
But I would have to look back, because I honestly don't remember. 2020,
Yeah, I mean, it was a long.
2022 was an ugly period.
Yeah, it was.
I think I was still full on, was I still full on mental then?
No, you were never full
Yeah,
on.
really, I think I did, I may still be.
It was a rough time
I
though.
would like to assert my Fifth Amendment.
Yes, you would. Yeah, no, even talking about this isolation and quarantine stuff is getting me nutty.
Yeah.
Because I'm getting spicy. Danielle, that's a new word.
Spicy.
I'm getting
We're-
spicy
you know,
about
there's
it.
sporty spice, and
Yeah.
there's what's the other one?
Ginger.
There's a bunch of them.
Ginger.
Five,
Yeah.
Baby spice.
Julie and I are angry spice, okay? We're angry.
Spicy spice.
Soon you'll have pumpkin
Yeah.
spice.
We're spicy squared.
I'm wishing, wood
Okay.
spice.
Yeah.
Fabulous spice.
I would like to call this monthly Board of Health meeting Wednesday,
Is that on?
August 13th to order. Yes, all the spice comments were recorded for posterity.
Start over.
Will you call the roll, please?
Danielle Sunaway,
Present.
Jennifer Locke,
Present.
Kyle Patterson.
Here.
Okay, I'm opening up two for, because that's what I do. Okay, I would entertain a motion to approve the agenda.
So moved.
Second. A motion is second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of the minutes of previous meetings, July 9th, 2025 is in your packet. I'd entertain a motion. A motion, is there a second?
Second.
All those in favor say aye. Aye. Opposed, that carries. Do we have any public participation in the audience? Okay. Seeing no public participation, I will go to correspondence from our administrator.
Not everything.
Okay. I just wanted to share as the chair that I've been trying to bring issues of housing and public health to this meeting. And I want to name that Champaign Park Apartments has been boarded up by the city of Champaign. It's been a process. I think at one point, someone drove their car through the barrier. So I'm told to reopen it. So they boarded it again. I don't know if all of the residents have been relocated. My understanding is that they were escorted out. And pets were left behind, and the county was called to pick up the pets, and they have no way of reunifying the pets with the owners. So our office has been trying to reach out to the 40, 50 or so folks that we were working with at Champaign Park Apartments to let them know that they can call, and they will keep their pet, and they will vaccinate it for free at the county, and they will keep it until they have housing. So that's the current situation. You may ask, as Julie did, where did they go? And the answer is mostly to the streets. There is not, the shelter has been full, and there has not been space for folks. So I will say Cunningham Township and City of Champaign Township partnered to house those that we could make contact with who had income to move into market rate housing, and we paid double security deposit, first and last month's rent. So we paid like 4 months of rent basically, and then a bunch of support for furnishings and a food stock-up. And so I think we served about 15 households between Champaign and Urbana. In Urbana, Havenstone has had multiple buildings also condemned. Not as large of an issue, but so it was between the two, and then there were about 6 families with housing authority vouchers and multiple households with permanent supportive housing vouchers. And so we also housed those residents in hotels. And we have about 4 households left from the displacements in both cities that are in hotels right now. Paid for by angel donor funds. Thank you, Julie. And the case management of we had a pop-up shelter during the heat spike that went up to, at least outside of the, in Champaign County, the highest it got was about 115 heat index. I feel like it was cooler within the city, probably because we have trees but still very high, 110. And we had a shelter at Salvation Army on Prospect Avenue, where we had 30 cots. Actually, I think it ended up being reduced to 26 cots. The maximum number of people we had was 22 people. There were still people sleeping outside strides during that time who were banned. But I do understand that outside of bands, strides had sufficient space between the two spaces. We had sufficient space, other than folks who had been banned from strides, many of whom were actively using, and Salvation Army did not permit folks in that state in our shelter, which is something we'll have to address in the future, but that's what it was. And of that crew, anyone who ended up, so we did case management, and anyone who had a plan for housing that was imminent, we were able to keep them we put them in Salvation Army. It was hotter than expected for longer than expected. Salvation Army has church on Sundays. We relocated everyone to hotels. Everyone exited except those who have a plan for housing, and Cunningham Township continued to house them in hotels. And so everybody who's able to get a plan, that's basically been our policy recently, is if we can get them on track for housing, we don't want to destabilize people and put them back out on the streets. So I appreciate Public Health for your partnership in making that happen. That's all.
And we have got to get something squared away for winter, because it's, we do. We have to get something figured out for winter. Big space, and we've looked at some, buildings or whatever, but I don't know where that's headed.
On Monday, we're having a meeting at the United Way offices about $1 million allocation by the Housing Authority for homeless services. The Housing Authority says it's one time, but everyone else is saying it's ongoing, so we'll find out more on Monday. I think they can't guarantee, and who knows with HUD. But I do think that could be a source that would support us having a winter shelter. And I intend to put something together that explains how much that costs and what it would look like. And we have a couple of different options for locations, so.
Okay. Any with showers? We could get like showers and laundry in a place, that would be.
Yeah, and I think that the Salvation Army location for winter shelter with showers is a good option. And I'm also meeting with
But they can't do it until
Michelle.
after December, they told me,
Recently?
when we were
That's-
doing the summer shelter. Because that's what they count money.
No, I thought they were going to look into a different location to count money.
Yeah, I did suggest a bank,
Okay,
but.
or their other office. Yeah. So,
Because
I am meeting with Michelle Jett in the county executive's office on Monday to discuss. So, okay. Anything else? Old business, I don't see any old business. We'll move on to new business, the treasurer's report.
Yeah, and this is fiscal year end, June 30th, 2025. We have cash on hand of $9,224,860. A total fund balance of $8,586,282. That was representing just about 51% of the budget expenditures for the year, which is pushing the high end of what our guideline is at, but it's at the right end of the guideline instead of the low end. We ended the fiscal year with a surplus of $1,224,716, and that was against a budgeted deficit of $886,399. Our total annual budget for the last fiscal year was just under $17 million. We had total revenues of $14,968,109, which is about $1.1 million under the year-to-date budget, mainly due to grants and contracts being under the year-to-date budget by a very similar number. We had total expenditures of $13,743,393, which was $3.2 million under budget. Personnel was under budget, of that 3.2 million, personnel was under budget by 1.2 million. Fringe benefits, 756,000, supplies, 253,000, and our capital outlay was also under the year-to-date budget by 856,000.
Any questions for Ron? See no questions, I would take a motion to put the treasurer's report on file.
So moved.
Second.
A motion and second, any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next, we have approval of payments to Board of Health appointees, to Treasurer Ron Fields for July 2025 services, and to Attorney Ruth Wyman for legal services for May 16th to June 13th, which is ratification, and June 13th to July 15th. I would entertain a motion on the bus.
Second.
A motion and second, any discussion? All those in favor?
Aye.
Opposed? The ayes have it. Next, we have review of the monthly credit card statements. Is there any questions that folks had? Okay. Entertain a motion to put the credit card statements on file.
So moved.
Second.
A motion and second, any discussion? All those in favor? Aye. Opposed? That carries. Next, we have ratification of the City of Urbana Community Services Grant for the Free Friday Market Program. I would entertain a motion.
So moved.
Second.
Motion and a second. Is there any discussion? This is $29,952 for the Free Friday Market. Is this a pass-through grant?
You wanna,
It's-
Jen's here, you wanna talk?
Oh, it says C.
It's a reimbursement grant for the city of Urbana. We do partner with Solifrontia Farm on the Free Friday Market, but they actually applied for this grant as well and got it on their own. So we're not passing through like contracting services.
Oh, okay.
We are purchasing a variety of things to distribute at the market and then increasing the education we offer at the market.
So the 29,000 is for staff and stuff, both? Okay. Staff and stuff. Okay, any other questions? All those in favor say aye.
Aye.
Opposed, that carries. Next, approval of lease agreement between the Refugee Center and CUPHD. And entertain a motion.
So moved.
I have a motion and a second, any discussion? All those in favor, wait, hold on. Okay, got it, I found it. All those in favor say aye.
Aye.
Opposed, that carries. Next, approval of a new conflict resolution policy and changes to the grievance policy. I'd entertain a motion.
So moved.
Second.
Motion and a second, can we just get an update on the primary purpose of the change and what the change is?
The new conflict resolution policy, I worked with Micaiah, DEI specialist, because we had employees who were not going to their direct supervisor with sometimes more serious complaints, sometimes just venting and that kind of thing, but we needed to get them to go back to their immediate supervisor. So we put this conflict resolution policy in place. It's informal, more informal than the grievance policy, and we hope to handle most of our situations through this policy instead of grievance, which we really haven't had any grievances in quite some time, actually. But this, that's not good. But that's the purpose of this policy.
Okay. I just had a question because I have been working on similar policies. Is it, okay, so I just want to, I'm seeing it now, if it's related, like usually you go to the person you have an issue with, then you go to the supervisor, then you go from that, then you go to the grievance policy. But if there is an issue of where somebody feels sexual harassment, discrimination, discomfort, like that level retaliation.
They immediately go to me and I pull in, Micaiah.
Okay, okay, I think that's
That
important.
jumps the,
Mhm. And then obviously if the person, that would include if they had that issue with their supervisor, they'd go directly to you.
That's correct, yes.
Okay. Any other questions? All those in favor say aye.
Aye.
Opposed? This carries. Next, we have a ratification of bid of RCP, not to be confused with RPC. Rural Mike Commercial Painting for repairs to the CHP office suite.
So moved.
second.
I have a motion and a second. Any discussion? My only question is whether they had a deposit.
Well, I don't believe they did.
No deposit,
No deposit listed in the lease agreement.
and that was predates your time or just?
No, it doesn't predate my time. It predates my,
Awareness of deposits?
knowing how to be a landlord.
Yeah.
That's what it is. So we're unfortunately learning on these things. That didn't stop me from going ahead and sending that bill to them. They just ignored it. But, you know, you're gonna have wear and tear on stuff, but this.
12,000 is a lot of
This
money.
went, it's now up to 15 because there was another room that hadn't even gotten looked at. That had dents all along the whole entire wall from the table. But it was ripping things off of the wall and
Yeah.
tearing stuff down, you know, into the drywall, and it was just a mess.
It just,
And we were completely surprised by it. So we had, you know, we set up the schedules to have people, you know, move in with just some minor stuff, and so that pushed everything back, so.
okay.
So we're learning, Pat's redoing the things right now, the
But-
leases, so we probably need to talk about how you do that. I mean, these are,
Are the leases, like for example, we just had a lease with the refugee center
yeah,
for a year. Did they have a deposit on?
no.
Okay.
And
it
they've
doesn't
been in
have-
there they've been in there, you know, for a while.
Mhm.
It's, you know, we've had quite a few people rent space, we've never had this problem before.
Mhm.
So, I mean, it's just been like minor stuff, and we just take care of it like you would if I moved out of my office and somebody else moved in.
Okay.
But this went beyond that, to where the whole place needed to be redone.
Yeah, it's a lot of money for a small space.
Yeah.
You may, if you want, we can talk about, contacting you, whether we wanna try to pursue anything, about reimbursement for, damage beyond normal wear and tear. We look at the lease agreement and that sort of thing and see what makes sense.
How
I mean,
long were they in the space?
a couple years,
Just 2
right?
years?
Was it 2 years?
Oh,
I
it's
think I
that
have to
long.
think, I don't know, it was, but the problem with.
At least 2 years.
Yeah, and it had been repainted, everything had been cleaned up, we had done remodeling, and it always got repainted after that type of stuff, because he had some changes and stuff that. But, yeah, you know, we're charging $1 a square foot.
That was my other question is, were we charging the market rate?
No,
No.
we never have, that did.
And I
predate
understand
that.
because they're a healthcare agency, but it, you know, maybe, yeah, I
Yeah.
think it's,
So that did predate me in this position, because when we first moved into the building, our first place was Child Advocacy Center. And they've been here, they're moving out. They've been here since we were. And, you know, that was the thing at the time. I believe at the time, our requirements for leasing for Fred were something like, it had to be somebody,
Nonprofit.
and somebody that was doing something that we would otherwise have to do, kind of thing. And then we can do that cheap rent. But, yeah, it was a problem. And they're back over here now.
they're here.
They're over on Hagen, or whatever that road is.
Oh, okay, yeah.
So we could talk about, whether there's any way to get relief from, any damage beyond normal wear and tear. Take a look at the lease and, see if it makes sense to do some contact, or maybe we can, I can talk with board members between now and next, board meeting to determine whether, sort of a sense of the board on, and look at what legally could be done as well.
I mean, how many square feet was it?
Jim's not in here.
The reason I ask
It's the
is
whole
it's-
veto suite up here.
Yeah,
So
no, I mean, I walked through it, I think that I'm just trying to figure out, if we're paying out 13,000, it's probably like a quarter, I'm guessing, of like the total amount of money we got off of it.
Yeah,
Yeah,
we will
like-
not, we don't make
like-
money off of these, for sure.
Yeah.
I mean, because,
Mm.
you know, we never do, that was never the purpose, but I do think that we're to a place now where, you know, if I assume that they had to have some kind of insurance, but,
Mhm.
Yeah, they have to provide a certificate of insurance.
Yeah,
I mean,
and so I
that's-
feel like then the question is whether we should pursue through the insurance. That
Mhm.
seems,
So I think we have to look at the contract, the lease contract,
Yeah.
and I don't think that's something in here, but it makes sense if, Julie or someone else can forward me a copy of whatever the most recent lease contract was, or a copy of each of the lease contracts that were entered into. We can see if there's anything in the contract, even if there's not something in the contract, we could look at damages, and there's legal basis on which to recoup for that damage, even if it's not part of a violation of a breach of contract. And then engage in some communication, make sure we're not past any statute of limitations, and then move forward.
okay. I think it would be warranted partly because it seems like they may be able to recoup this from their insurance and, you know, sending them the invoice was the proper first step, but maybe a communication from our attorney will get their attention. Okay. Any other discussion? All those in favor?
Aye.
Opposed, that carries. Next, approval of check request payable to Feinberg Sony Inc. for Smile Politely annual advertising in the amount of $6,000. I would entertain a motion.
so moved.
Second.
A motion, a second, any discussion? All those in favor?
Aye.
Opposed, that carries. Next, we have approval of check request payable to the City of Champaign for the 2025 Black Mental Health and Wellness Conference sponsorship. Entertain a motion.
So moved.
Second.
We have a motion, and a second, any discussion? My only question is, do we know how much it costs to run the conference as a whole?
That's about 30,000.
About 30,000? Okay. And then, so different folks are then paying into it. I will say, we sent staff last year and it was really great. Like, we had really good feedback from the conference and very supportive. I just want to make sure we're not paying the Lions, like that it's a shared expense within the community. So, thank you for that. Any other discussion? If not, all those in favor say aye. Aye. Aye.
Aye.
Opposed, that carries. Next, we have approval of requisition payable to NASEN for insulin syringes. I'd entertain a motion.
So moved.
Second.
A motion, a second, any discussion? All those in favor?
Aye.
Opposed? That carries. Next, we have approval of check request payable to A1 Pavement Maintenance for fiscal year 25-001 parking lot resealing. I'd entertain a motion.
So moved.
Second.
I have a motion and a second. This is work that's already been done, correct? That we're paying now? Okay, yeah. Any other discussion? All those in favor, say aye.
Aye.
Aye, opposed, that carries. Next, we have approval of requisition payable to McKesson for Dax.
Naloxone.
Thank you, naloxone. Okay.
Second.
Naloxone, I like to, okay. I've entertained, okay, yes, we have a motion, we have a second. Any discussion? All those in favor say aye.
Aye.
Aye, opposed, that carries. Let's see, ratification of check request payable to Illinois Fund for additional investment of Illinois funds.
Skip one.
What?
13. This one.
Yeah.
Oh, sorry, approval of check request payable to RCP Romine Commercial Painting for fiscal year 26-004 TAS office area. I'd entertain a motion.
So moved.
Second.
A motion and a second. Any discussion? It's $5,796. All those in favor?
Aye.
Opposed? That carries. Okay, now we will get to ratification of check request payable to Illinois funds for initial investment for Illinois funds.
So moved.
A motion and a second. Any discussion? I had ratified this on, I had given approval on email. All those in favor, say aye.
Aye.
Opposed? That carries. Next, we have pending contracts for the administrator to sign. A motion to approve her signature between CUPHD and IDPH for 2025 harm reduction community linkages project in the amount of $38,278 in the division of TAS for September 1st of this year to August 31st of next year, and also CUPHD and IDPH fiscal year 26 Illinois tobacco-free communities in the amount of $220,565 to the Division WHP for July 1st, 2025 to June 30th, 2026. I'd entertain a motion.
So moved.
Second.
A motion, a second, any discussion? All those in favor say aye.
Aye.
Opposed? That carries. Next meeting is our monthly meeting, September 10th at 5 o'clock. And seeing no further business, we stand adjourned.
That was Sandy Cornstalk right there.
That was me.
It's-